Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing the possibilities that you have with Molina and their Medicare plans available in Texas. So we're going to be spending quite a bit of time on a D-SNP product I think you'll find very interesting. Today's presentation is being recorded, so it, along with some of the material I reference and we reference through the course of the presentation, will be sent to you as a follow-up through an email, but the recording link will be in that, but also posted on our website at premiersmi.com and on our YouTube channel. You'll note in the software there is a section for both questions and chat. I think as we go through this, you'll notice I'm a chatty guy, but we want to make certain that you put any sort of questions that come to mind in the question section. We find that we do address many of them through the course of the presentation, but we want to make certain we get you all the information that you need to be effective in this space with Molina. We concentrate on Texas in today's presentation. Huge market with markets across the state that couldn't be more different depending upon where you live. So we'll go through those different things and make certain that you have the information you need to effectively be an agent with the Molina program in Texas. As a bit of a level set, many of you are familiar with Premier and who we are, but a kind of a information for others. We're a national marketing organization that's founded in 1968. That's part of the Integrity Marketing Platform. We've got offices across the country. Doesn't matter if you're here in Texas, but we're in all 50 states. We offer the insurance products to the public through independent insurance agents such as yourself, and those contracts are available at the highest possible commission levels, with recruiting contracts available to those who qualify. It's done through a full portfolio of products. We cover the basics in the Medicare arena with the Medicare Advantage, Medicare Supplement, and standalone Part D plans, the PDP programs, but we also offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, strong programs in the long and short-term care arena, along with disability income programs and ancillary benefits, such as dental, vision, hearing products, critical illness cancer plans, hospital indemnity, accident, and we even rolled out a telehealth program with MD Live here in the last 6 weeks. When we look at the Medicare Advantage portfolio, all of the national carriers are there for you through our organization, in addition to many folks that are regional carriers that are very much a factor in your chosen market. That same philosophy carries over into the standalone Part D programs, where those national players are there for you through our organization. Many times it's part of the same MA program, the same MA contract that you have with the carriers in the other instance. When you look at Medicare supplements, we got a broad portfolio of products and include programs that are put in place to help you be successful with this market. We want to make certain that we not only cover the base choices, but also ancillary programs that are of great interest to folks in these different categories, where we've got the national leaders there for you as well. When we look at the Medicare market, obviously, you don't come on a program like today without somebody like me saying, boy, look at the aging of the baby boomers, the silver tsunami, 10,000 plus a day, one every 10 seconds. Well, if you look at Medicare based just on age, your perspective is a little bit off in the fact that we're seeing an increasing number of people that are referred to as the working aged. And I say that because I'm getting close to it and I go, wow, where'd that old person come from? But you'll have a number of people that won't access all their benefits when they're immediately eligible based on age. So that pulls that number down a little bit. But we have to consider the folks that qualify for Medicare based on medical disability, 15% of the population. Today's program is particularly apropos for this market as well. It's one of the nice things you have as an independent agent, where you can cover the spectrum of needs across the Medicare population, because there are some things we see consistently. 3+ chronic conditions on average. 66% of that population have some challenges with their health. So we need to make certain we protect them, and do so taking into account their income and assets, because that can be a big factor as to what might be the most appropriate choice for an individual, because they have choices. They don't have to do anything. They can actually decline the Part B if they choose to do so. Thankfully, not all that many do. Some will then self-insure for the rest of what Medicare and Medicare A and B doesn't cover, but most will pick up at least that standalone Part D program, and some of them may augment that with a standardized, modernized Medicare supplement to cover the medical portion of it, or pertinent to today's discussion, especially option into the Medicare Part C programs, where they are bundling their benefits in most cases completely across the board. And we want to make certain we have options in each of these categories and we know how to address the similarities and the differences. What we see when people actually enter into Medicare, be it right when they age in or some of the late to Medicare seniors, we're seeing a pretty even split as to choices of the folks that are coming on. But as you can see, that data is from Deft Research. It's nearly an even split when people come in to the programs or first eligible that are getting the ancillary benefits. And then you have a portion that will show up as original Medicare only. That doesn't mean they're not in one of these programs necessarily, but it may be where they have VA coverage or they are a dual beneficiary, have Medicare and Medicaid. They might have retirement benefits. There's a number of reasons why a person will show up in this category. We want to make certain that we take care of them. And sometimes that entails translating some of the terms that are thrown at them. Each industry seems to have their own acronyms. As part of the follow-up to today's presentation, you'll get a link to this government affiliated program through the Medicare Learning Network where you have access to commonly used acronyms. I've been in this space for 30 years, 35 years, I don't know. There's always something popping up that you can't recognize. Sometimes it helps us for a reminder. And then we have to take into account not only the translation of the benefits when we can speak to them about different programs. The vast majority of them all year long, obviously. We've got the standardized in election periods that we've all recently experienced, but then we have the special election periods that give us other opportunities to address people throughout the year. And you look at some of the standardized SEPs, the things that we see on a consistent basis, you see that the majority of people on Medicare may qualify for a SEP throughout the year. It's a question then of, are we doing the right thing for that individual? We also have pardon me, my mouse is going a little wacky with me here today. We also have a listing of all the additional special election periods. See, I actually spoke the definition of what a SEP is. We actually then have all the additional SEPs that have come into play because of Mother Nature. There's one that came out because of civil unrest on the border. So different things that will come to you so you can identify those selling opportunities as well. It's particularly important for us as we go through and encounter the population that are eligible for these programs. We will realize that the majority of people aren't doing annual reviews. So there's a need throughout the year for us to visit with them. And the folks that are in the target market, in many cases for a dual special needs plan, particularly, are some of the folks that need the education the most. There's some of them that they don't have access, or if they to the internet or some of the information that's out there. There may be a number of reasons why they're not accessing it, and even if they are, they're having some challenges understanding those differences. So that's part of why we want to make certain that even if they're not using the government sites, we have private programs that can help disperse that information as well. That's available to you as a contracted agent that can really make a difference in people getting the information they need, understanding the Medicare choices that they have, and we can perform that either in person or through a virtual experience. We're never going to go back to the old normal completely. And we have a number of agents we talk to on a regular basis. They really like doing the virtual experiences. Their productivity is up. But there are some areas where an in-person interview obviously will help your persistency, help keep the people on the books. There are a number of reasons why you would still want to do that. We, however, have to make certain that we're prepared to pivot and we have the information available to do a presentation either way, because we're training them to do it. You'll see in many circumstances, that these folks have been trained by their doctors through the COVID crisis and the pandemic that we all see. I've got a doc that I've had 9 visits with. I've never met the man face to face. It's all been digital. And we see that not only with doctors, we're seeing hospitals do prep work, even dentists are using some virtual tools to make accessing benefits as safe as possible and as thoroughly as possible. And if you think about it, church services for an entire year have been in that circumstance. So people are trained to access this information, and we want to make certain we give you the tools to do that. And partnering with carriers such as Molina make that easier because they help us along those lines. Which takes us finally to one of the favorites of most people on one of the webinars I conduct. I actually shut up and turn control over to our guest presenters. I think you'll hear Kevin's voice a little more than Ralph, but I might be wrong, but we'll go with it. These are the folks that are our guest panel from Molina today, and they're going to walk us through a higher level of some of the opportunities in Texas. I'm going to turn control over to Kevin. Kevin, we now should see, if you share your screen, I believe, we'll pull your presentation up, and there we go.
Okay, it should be the main screen, not the preview that PowerPoint gives you. So if you see one screen, let me know if that's what you got, just one.
I get one screen and it does the preview of the next one. So we're perfect.
All right, so let's figure out my display settings here. How about now? One screen. Okay. So thank you very much, John, for allowing us to speak to your group today. And thank you all for taking the time to join us. I know you all are busy, and these things, they're important. We need to, you need to make sure that you have all the information. And I can't thank you enough for taking the time out of your busy day. My name is Kevin O'Connor, and I am the broker channel manager for Texas. I newly acquired Texas about 2 months ago. My home base is actually in South Carolina. I live in the beautiful city of Charleston, South Carolina, and I love this area, but I was very excited when they asked me if I wanted to take on Texas, because to be perfectly honest with you, if I was to leave South Carolina, it would have to be for something like Texas, and it would also have to be for a lot of money because I really like it here. But nonetheless, I'm excited about the opportunity that we have in Texas. So I'm going to go ahead and jump right into this. First, I would like to say really quickly, thank you to my colleague, Ralph Taylor. He's kind of what I do. He has a national presence. We know that Premier has a huge presence across the country. So I asked Ralph to come in kind of as support in case we wanted to expand a little outside of Texas. However, I don't think we will, but he is here if those kinds of questions come up. So without further ado, let me go ahead and talk about the Texas service area. So we're not all over Texas. We are newly into these counties here. And of course, our existing footprint is right here. So if you live here, you're going to want to do everything virtually. However, we do cover all of the major urban areas. We have Dallas, San Antonio, El Paso, Houston, San Antonio. I'm probably missing one, but and then we're down in the valley, of course. So what makes Molina unique? Now, I'm just going to go over this briefly, and I kind of wanted to share this because, we're physician founded, and that is cool that our Dr. Molina founded Molina in the 80s, and his mission was to make sure that everybody needed healthcare, got healthcare. That mission remains today. That's something that I'm very proud of as an employee of Molina. I think that a lot of us get into this business to help, and it so happens that we can make a fairly good living and still feel good about what we do. Experienced leadership, 35 years of focus on government sponsored programs. We're a DSNP industry leader. all of this stuff. This is pretty much standard. You're going to get this with every carrier that you deal with. The one I like to talk about the most is our commitment to the broker partners and our superior service. So for Texas, what I can tell you is that I am here. I know that for those of you who are familiar with Molina and have worked with us in the past, we have not had this position filled up until 2 months ago. It's been about a little less than a year. So it's been somewhat confusing because several different people were kind of handling it. But I am now the guy, and I want you to know that I hear you and I want to hear you more. I need your input, and I want to know what we can do as Molina and as your partner to make things better. We want to make sure that whatever you need, we can address. I promise you, when you call me, I will either answer the phone or I will return your call. And I look forward to those opportunities to speaking with each of you individually. Some of you I probably have already. I literally went through my entire roster over the last few weeks and called or emailed everybody. So let's move on to the stuff that we all want to talk about. Let's talk about the supplemental benefits. Now, before I jump straight into this, I do want to touch on the fact that this is a D-SNP plan. We currently have, like I showed, those 53 counties. We recently, and this was made public about 2 weeks ago, purchased Cigna's Medicaid presence in Texas. Now for this year, I'm not sure how that will benefit, but what that shows me, and this is just me kind of predicting the future, is growth. Now, of course, it's way too early to start talking about anything specific for next year, but you know, if I'm to look into that and look into my crystal ball, that tells me that there's a good chance of some potential growth coming up soon. But for now, that doesn't play for 2021. That doesn't play. So, of course, the basic benefits of a D-SNP are all the same. I don't care what carrier you go to. If you're a full dual, you pay zero for all of your benefits. What makes the difference is the supplemental benefits. So, in my opinion, the number one supplemental benefit, the number one hot ticket item is usually dental or OTC. I have just talking to you all in the area, dental seems to be the biggest seller. So we have teamed up with Delta Dental to create our Medicaid network, our dual eligible network. You get a $2,000 comprehensive allowance, and of course, it's zero copay, zero deductible. The beauty of this program is that there's no limit on preventative services, and those preventative services don't count towards that $2,000 comprehensive dental benefit. We also cover dentures. And the one thing that I always remind all of my agents and brokers, we have to educate a little bit, make sure they understand that they have Delta Dental and not Molina Dental, because the dentist will be completely confused if they tell them that they have Molina Dental. Now, if you want to look up providers, so on, here's the information for there. Don't worry about taking notes. I'm going to send this over to John. I mean, you're more than welcome to take notes, but he will have this for your reference. Hearing, we use Hear USA, and as you can see from the picture, they have the highest level of new technology. They have 5,000 locations nationwide. The coverage itself includes a routine hearing test, fitting, evaluation, hearing aids, choice of 10 hearing aids from all major manufacturers. Now, I always stop at this bullet point because I don't care who you are. I don't know anything about hearing aids. I know that they go in your ear, and when the batteries start dying, they whistle, and that's it. But there's something about having the choice of 10 hearing aids. You know, I know that other carriers that I've worked for, it's been one or two. There's just something about giving these folks the right to choose. It's empowering. It makes you feel a certain way. So I like that feature of the benefit. And I think that our folks in Texas will also appreciate it. Routine hearing test and fitting, so on. There is no referral or prior authorization. The only time prior authorization is going to be required with hearing aids is for the hearing aid itself, because there's basically, if there's a cost of that level, you can just count on prior authorization being required. And of course, here's their contact information as well. So the vision, I usually just kind of skim over this because all of the carriers are very similar. You get a routine eye exam, contact exam is not covered, but it can be taken from your eyewear allowance. And the materials that we cover are contacts, eyeglasses, and now you can get the eyeglasses as a set, lenses and frames, or you can get lenses a la carte and or frames a la carte. And then of course some upgrades, tinted, UV, polarized, blah, blah. And then of course the routine eye exam is $0 and you get $300 towards your eyewear every year. And a reminder that if they do choose the eye exam for contacts, that comes out of that $300 allowance. And again, I have included their contact information. So this one, the over-the-counter benefit, I remember when this first became a benefit in my area here in South Carolina, it was not popular. And it's weird to me because it's in South Carolina, it's become the most popular. And I have a feeling it's probably spiking a lot in in Texas as well, as I will find out as we progress forward. So of course, the over-the-counter is non-prescription health and wellness items. Two options for ordering. We have the traditional OTC catalog. You can go through, find what you want, order over the phone, online, mobile app, or mail. The one thing I really like about what Molina has done here is our catalog is it's pretty. I mean, it looks good. The pictures are clear, and it's big. It's over 450 products. It's easy to use. So I've worked with other carriers where there was no pictures. It was just all written. That doesn't work out so well. When they do order, products will be shipped at no charge within 5 to 7 business days. Now we have a second option, and this makes me very excited, and it should make, if any of you guys work in the Walmart stores during AP, this is the second option. They get a Visa debit card that is good for OTC items at Walmart. It's only good at Walmart, but we are working with our vendors to try to expand the places you can use it. But for now, it's only good at Walmart, which in the grand scheme of things, I have dozens of agents that are working in Walmart's every AAP. So if you're one of them, this is a great selling point. The benefit for 21 is $290 per quarter with rollover. Also very attractive. So essentially, you what is that? 612 minus, you get 1160 a year. So that can either go to your every month, or excuse me, every quarter, your Band-Aids, aspirin, and so on, or you can save it all up till the end of the year and buy everybody OTC things for Christmas, and it would be a pretty hefty load for your Christmas gifts. So, and I've included their contact information as well. All right, I'm going through this pretty quickly because I know that you guys all know this stuff pretty much forward and backwards, but I think it is important that we just kind of review. So transportation, 61-way trips, non-emergency transportation to and from plan approved location. So the quickest way to decide what is a plan approved location is if it is medically necessary. Like you can see the 3 examples here: doctor, dentist, eye doctor. If they're going for labs, whatever the case may be, if it's medically necessary, it's very likely a plan approved location. The other thing I really like about our transportation benefit is that if you have a loved one that is your transportation, instead of using the van, the wheelchair van, you can have mileage reimbursed to your loved one. So it makes you feel like you're putting into your own care. It's a rewarding option for those that use that option. And it's simple. They just call the appointment line, or excuse me, the reservation line, and set up the trip prior to, and they get a reimbursement within 30 days. Fitness benefit. I used to love selling plans based on the fitness benefit. And then I love doing my follow-ups 3 months later and asking them, hey, how's that going? Oh, still haven't gone yet. Still haven't gone yet. So the thing now is that a lot of our senior demographic isn't going to the gym at all anyway, because of the high risk with the COVID and so on and so forth. So with Silver and Fit, we have all these extra home home exercise kits. But the benefit still does offer a free gym membership to a participating gym. And there's two types of kits that are offered. They can select 2 of the 34 home kits, or and a Stay Fit kit every year. So the Stay Fit kits are new this year for us as we upgraded from fitness coach to Silver and Fit. In addition to all of that, there is a digital library of over 1,500 digital workouts on the mobile app or the Silver and Fit website. Now, listen, I understand that a lot of our dual eligible demographic, they're not using a cell phone. I also understand that you, as their agent, know them better than anybody. So if they are, give them this info. They may love it. Same with the over the counter. If you can show them how to use the online or the mobile app, if they're that person, then do it. It's also a great way to have an excuse to do a follow-up call, keep your clientele engaged. And then of course there's one-on-one healthy aging coaching sessions. Here's a quick list. I won't go over these individually. You can just take a look. Like I said, John will have this for your all to reference. And then the last part of this, which is my favorite part, these Fitbits, or there's a Garmin option too. It's a wearable activity tracker. It is what it is. I think it's neat. I think that this population of people under normal circumstances probably wouldn't have these. And I think that to offer them, why shouldn't they have them? So I think it's a great selling point. I think it gives them, for those who really want to try to stay active and or struggle, I think this gives accountability and encouragement. So I truthfully, I really like this benefit. And I think to the right person, it's a good selling point. In addition to those 2 activity tracker options, they have these options for strength kits and or a yoga kit. Now, the PERS device, this I was very happy we kept. It has, the company CST has actually upgraded the PERS device. So in the past, it was push in case of emergency. They have upgraded that. So now you can push in case of loneliness. I think it's a wonderful idea. We all know that a lot of times we would walk into people's houses and they're lonely and they talk and you're with them for what you thought would be a 45-minute presentation and sale ends up being like a 3-hour presentation. And that was before COVID. They were lonely. So with COVID, now they're lonely and they're isolated. So this company, CST, who I found out recently was bought by Best Buy, of all people, has upgraded to include a loneliness option to, they just call and chat basically. So back to the topic here, the basics, the thing, what it is a 24/7 at home and on the go anywhere in the US. So it's taken the I've fallen and I can't get up to a new level because it has its own built-in cellular communication. So they don't need a landline or cell phone, Wi-Fi or internet. It's very simple to use. You just plug in and play, and it's lightweight, comfortable, water resistant. It has a neck pendant or the wristband option. When you push that button, it's 2-way communications. It's not just you pushing and them yelling at you. It's push and you respond. And if you don't, they will find you with the GPS location service. So if you're an active senior and you're out hiking or whatever the case may be, now depending on where you're at here in South, if you're out between 2 swamps on a hiking path, you might want to consider where you're hiking. But in most cases, it has an incredible reach with their GPS location service. And another new feature is the fall down detection, which I really like. As a son of a aging mother who has Parkinson's and was falling all the time, this makes me very happy. So she has one of these things, and it's fortunately hasn't come into play yet, but it's something that will give peace of mind to family members. And of course, it has a charger, and the last bullet point, Bluetooth technology connectivity to home health devices. Every time I get to that, I have no idea what home health devices that would connect to, but it's got Bluetooth, and Bluetooth is cool. So that's a good feature for that product. So as far as the referral and the prior authorization, the PERS benefit is available to qualifying members with prior authorization. Again, high cost, likely going to come with a prior authorization, and the case manager will decide whether a member qualifies. The bottom line is, if a member is deemed medically qualified for this, our case management will do what they have to do to make sure they qualify. It's one of the things I really like about Molina is the strength of our case management team. They're wonderful. So that's that. Those in a nutshell, and I know I went flying through that quickly because I really wanted to talk about some other things. I wanted to talk about working together with Premier. Molina and Premier together can do a lot of great things, I think, in Texas. And so I kind of rushed through that. So I encourage any questions I will gladly address. But let's talk about working together. So we have a lot of options to help our great agents in the state of Texas. We don't have a statewide presence yet, but we are in growth mode, as you can see from the bottom bullet point there, and that is our mentality. That's what me and Ralph have worked together to really kind of make Texas a staple in our Molina portfolio. So how are we going to do that? How are we going to work with you guys to grow our footprint there and to help you guys succeed? First and foremost, our biggest weapon, and I know this is an option for everybody, is co-op. And the majority of that money will be spent on direct mail. Now, we all know that with COVID, that co-op got beat to death. So we have to be smart with our co-op targeting, and we have to use the right vendors. If you've used the same vendor over and over again, maybe switch, get a different perspective. That's neither here nor there, because with our co-op, it's your choice. We call it a co-op, but it's not a traditional co-op. It's not we throw in 50% and you throw in 50%. We'll give you 100% of the cost of the mailer. What your portion is the footwork. You find the vendor, it's your vendor. You find the target area, wherever you think you can be successful. And then we send you the money and you actually pay the vendor. So it's your account, it's your everything. All we ask is that we get our return on investment, and with the right broker agent, we will talk individually and I'll get that set up for you. So the next bullet point is sponsorships. This used to be a lot more prevalent. Obviously, the world changed last March 2020, and there hasn't been any grassroots. Now, I live in a state that's opening up, and I know Texas is pretty much wide open. I still practice, what I respect the people I'm dealing with, so I do whatever they're comfortable with. Personally, I'm pretty much open. I still wear my mask when I go into stores. That's where I'm at. But anyway, as these things start to come back, if you are working in food banks or whatever, and you need, I don't know, whatever the case may be, if there's some sort of grassroots marketing event that you're working, call me. Let's see if there's something we can do. If it's an entry fee, or if it's for your table fee, or whatever the case may be, I want to help. Again, it's the small things that I can do that can help you grow, which helps me grow, and then we grow together, and then we're all happy and celebrating at the end of the year. Next, simple marketing materials. I have everything from flyers for you to put in your own direct mail pieces to brochures that you can drop off at centers of influence. These all they're Molina branded, but they have your personal, or not your personal, but your contact information. So when people grab these flyers, they call you and not us. Now, hopefully that when they do call you, you enroll them with us, but that's how that works. So I used to love putting those brochures in. Optometrists were my favorite because we pay well to our optometrists. Dentists are another one that are usually excited you're bringing in another $2,000 to them. so on. And then of course, promotional items. I have a huge list of different promotional items, and I'll gladly share those with everybody. So, and then I've already kind of touched on this next bullet point: proactive broker channel manager and a broker channel manager team. Perfect example today, Ralph joined me. Ralph and has done a lot to kind of shake the tree in Texas, and that's just who he is. I am very proactive. I try to be proactive instead of reactive. So that's why I need to hear your voices. When there's things that we can get out in front of, I want to. So, and in addition to that, like I said, if you call me, I'm going to respond. I'm either going to answer the phone or I'm going to call you back. A funny story, I had a carrier rep, and I will not name the company, who actually had on his voicemail, I will not respond to your voicemail. If you would like to, if you'd like a response from me, please send me an email. You're not going to get that from me. And I promise you won't get that from Ralph. You won't get that from Dave Peters, who is my boss. The fact is we are going to communicate with you. So I'm sure all of you have received my bi-weekly email update on the state of Texas, and I hope you actually read them. And I hope to get a response every once in a while from a few of you. But anyway, last but not least, like I've already said, growth mode mentality. We are looking to grow. The fact of the matter is, Texas, like I said, is going to be we want Texas to be the cornerstone of our portfolio. And one of the things I like to always say to folks is, you have a lot of options. I think there's 12 D-SNPs in Texas, and some folks get so single-minded and they put everything in one basket. The fact of the matter is, you never know really what's going to happen. So it's always good to diversify your portfolio. And I would say that to no matter who I was representing, you want to get a little bit of everything, because you never know. Someone's going to lose a contract, someone's going to pull out of a county, and then you're doing a lot of extra work or losing business. So there's enough out there for all of us. And there are a bunch of people that would be truly happy to be in a Molina D-SNP plan. So real quick, I just want to post this up here so you guys have the information. This is some pertinent contact information. Skip me because I'm going to show me again here in a second. The broker services team, they're wonderful. I call them. They will work any issues you have to fruition. And member services, of course, for your members. The Molina website, it actually houses the next two things. So it's the provider lookup tool, it's the provider online directory, and the online pharmacy. So it's just molinahealthcare.com and then /provider search for these two. And then lastly, our broker portal, which is through Calidus, and there's the link to that. And then here's one last plug for myself. There's me. Give me a call. I listen. This partnership with Premier is important to not only me in Texas, but it's a big thing across the country. The name speaks for itself. It's Premier. I'm excited about the future with you guys, and I want to hear from all of you. So if anybody is interested in learning about the co-op opportunities or any of the marketing materials that we have available, please call me. Here's my phone number. That's my cell phone. I will answer that 6 days a week, or at least return the call on Saturday. I will answer it Monday through Friday. Sundays generally family day, but I will, if you leave me a message, I will call you back. So that's what I can promise. And that's all I have. I truly thank you, John, for having us here. And if there's any, I don't know if any questions came in, but I'll gladly answer those at this time.
There's a couple when we speak to some of the ancillary benefits, and thank you, Kevin. We really appreciate your help here today. When we speak of the transportation benefit, it alluded to a need, a specific need to qualify for that service. Pharmacy trips?
Pharmacy trips are considered a plan approved trip. So, which I'm glad that was actually brought up, because I'm going to go off on a tangent here. One of the things that this vendor does is, if you have a doctor's visit, so it's one-way trips, the trip from the house to the doctor is one trip. Well, let's say the doctor writes prescriptions. the trip to the pharmacy you would think would be another one-way trip. But since what they have done is made it, if you're going to the pharmacy on the way home from a doctor's visit, they don't count that as a separate home or separate one-way trip. So you get, it's just 2 one-way trips instead of 3. So, but yes, the answer is pharmacy trips are covered. And on a side note, that if they're going to the pharmacy on the way home from the doctor's office, there is no extra one-way trip charged.
That's awesome, because not everyone handles it that way. You have that
No,
extra dip in it. And if we're doing 60 trips for a year, 5 a month, that can, one doctor's visit and visiting all the other pieces with other carriers, that you can exhaust that benefit really quickly. The other one's
right.
kind of
Well,
a question too, that the gym membership,
yep,
that is not eligible for transportation.
that is not, unfortunately.
Okay, then that makes sense as well. It's a neat. I really like the PERS benefit when it deals with one of the hot acronyms out there is the social determinants of health and social
Yes.
isolation. We see all kinds of study where that is really a valid indicator of someone's state of mind. Obviously, we see a big spike in telehealth for mental health benefits, but we also see, like you said, it's that sense of isolation when you're sequestered, and it's neat to see that you have a health plan that is actually addressing that. When we
Yes.
speak of some of the other stuff, like you said, you have a lot of commonality with different DSNP plans. We've got a webinar recorded that I'll send as part of the follow-up that goes through DSNP generically, to pull in some of that information for folks. But it's a nice indicator that a lot of the benefits are the same, but some of the extra things that you're doing on the marketing support is commendable. And when I look at the attendees of today's event, I see a number of names right away that we're going to discuss the possibilities there really quickly. So thank you for that. I
No,
am
that's
going to pull back and sorry, I'm going to take back control of the screen and give some folks a little indication as to, okay, it's a great program. You got good support, great support there. Why Premier, in a manner of speaking? Why do business with us? And if you don't mind to hang on through the end, Kevin, to make certain that any of the questions that might pop up will be there for us
no,
and
I'm here.
off if possible. Some of the things obviously that are available through our organization are some of the things that can make a difference into how we handle some of the back office piece. Creating a profile in the Assurance Bay system gives you an opportunity to contract with multiple vendors electronically. That's particularly important for folks that look at the entire picture and realize that no matter how great some of the extra benefits may be, sometimes an additional standalone program on dental or something of that nature can, as long as it's a plan that has pays in addition to, it can make a big difference in fully addressing needs. So looking at some things holistically can make a big difference. This can make it easy for you as an agent because, oh boy, did I initial the right page or that sort of thing. You create that profile and it can help you walk through that. We also help with discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? You got a contract with us. One, it's all it takes. But this is a program you actually purchase and you own. So it can be applied across the board. It's not like working with a marketing organization says, we're going to add you to our blanket policy for this program. That's great for that program. We find that very few agents only offer one company, only offer one contract. This will apply across the board, satisfy that qualification that just about every carrier requires, and takes care of you, protects you on your own malpractice type of coverage. We also make available the continuing education bundles through our association with WebCE. Make certain that your license stays in play, and you can pick up modified guarantee issue DI coverage for yourself and be paid a commission on it through this program through our association with Disability Specialists Incorporated. Much as where today's presentation is being recorded and will be dispensed to everybody and available online, our library of past presentations are available to you there as well through our website or our YouTube channel, which gives you information on carriers, products, but also different marketing programs that we'll talk about in a little more detail in just a little bit. which really coincide with some of the opportunities that Kevin and Molina offer us here in Texas on the how do we get out in front of people? How do we make certain that they are there for us to visit with? You'll find information in this that can help in that regard too. As a contracted agent, you do have access to our Medicare Center, which is a quoting, selling, saving information type of platform with 3 different search engines that come as part of it, all available through a single universal login. Provides a CRM for you to manage and track your client base. So that's in there for you, available without cost. It does give you the opportunity to capture the information you need to stay compliant as well in the Medicare Advantage and PDP space, where you can collect that scope of appointment electronically. It stores it in that system for 10 years like it's supposed to. And keep in mind, you need that if you sell that appointment or not. So we want to make certain that it's there. But inside this, you have 3 different components. You got the Medicare app, the Medicare Link, and the CSG app, all in a single place, all accessible for you. So you have the power of Connecture, Sunfire, and CSG all in the same tool, all at no cost to you as a contracted agent with our organization. And that CSG tool really does some really cool things that can help augment some different pieces of needed information for cross-selling with different quote engines and other opportunities you have to make your life a little bit easier to offer a portfolio of products. We do that because simply you have more products in the household, drives up your persistency, the retention. And that is, for all sakes and purposes, all intents and purposes, that's our salary each and every year, our renewals. And as we have more products in the house, they don't have to be with the same company. They have to be just with the same agent. It'll drive up the factor of people staying with you. Many organizations do offer different incentives to work with them. Different carriers do that. In the Medicare Advantage space, PDP space, well, CMS sets the reimbursement on that. So many of those incentives and trips don't apply in this circumstance. But if you are cross-selling and offering some of those ancillary programs or other offerings that do qualify, it can help you qualify for the premier incentive trips in addition to that, which last year was supposed to be a cruise, turned into a lot of cash in a lot of agents' pockets on a virtual getaway. Helping you get in front of folks, well, we do offer a contact list if you are a smiler and dialer. Can't do that for MA products, but there are many of the programs that are out there that you'll see a rate increase from 64 to 65. I'm referring to a lot of the dental programs. So that's a great, unique way to approach the T65 market that might not be as beaten down by 30 calls a day as they turn 65 for the base medical. It can lead to that discussion, but you also have the different community-based programs. Kevin referenced the Walmart opportunity in retail. If you are working that just during AEP, you're cutting yourself short. You've got a lot of investment in that during that time period. We want to make certain that you understand the possibilities on year-round lead generation from retail, be it with Walmart or a carrier-specific opportunity or one you created yourself. So we want to help in increasing the return on your investment there. And with that same philosophy, we work with different centers of influence in the community. Kevin spoke of the difference that we saw in events in the community where the support wasn't necessary because people weren't doing face-to-face or live events. Consider a virtual opportunity. And if we work with different centers of influence in the community, particularly the faith-based organizations, we can use some of those resources that are out there with our organization that give you different topics that you can do on a live seminar or on a webinar, speaking about Medicare 101 or the advantages of a Medicare Advantage plan, different programs that are out there where you have a presentation already created for you and gives you the opportunity to approach these folks, establish that relationship, and deliver that message. Because many of them will respond to centers of influence, and they're not calling in off of TV ad, no matter what Joe Namath thinks, aren't responding to radio or perhaps even direct mail, but they will listen to a message that's delivered by someone they trust. And that includes the churches, the mosques, the synagogues, We have programs set up that can help you in that space and kind of a carryover into provider marketing. Kevin mentioned working with the optometrist. Great idea. Not as heavily marketed in many circumstances, but also consider, of course, the primary care docs, the specialists, other deliveries of the care that we speak to. But another area, well, Kevin referred to a $2,000 benefit with dentists. Working with dentists is a great way to leverage provider marketing. There's a recording on that as well, so I'll have a link to some of that. Some of the things that we see during different times of the year too give us an opportunity to access carrier-generated prospects. We see that most frequently with M8 carriers during AEP, but if you've established yourself as a partner with a carrier, you may see that carry through the year. And our partnership with Molina, when you deal with the D-SNP market, remember, that is a quarterly SEP. So that's something that you can market through the first 3 quarters at least. That's something you can market continuously. And we have the opportunity then to make certain that we establish that relationship. Kevin knows you're a go-to type of individual, and we look at that in that fashion. We also have different internet lead and direct mail support we'll talk about in a second, and a referral program that helps you maximize the value of every appointment, every discussion you have with a prospect or caregiver of a prospect. That link will come to you as part of the follow-up too. When we speak to the direct mail benefit or the co-op that comes with it through our organization, based on your productivity, you can really drive down the cost of a consistent mail campaign. You can bundle it with some of the other programs that are out there, Molina's assistance on a mail campaign, so double up. Plus, if you work final expense, you can qualify under 2 different programs with our organization and basically get an inexpensive 2,000 piece mailer if you're working both of the areas. We do that through preferred lead vendors. We vet the information that they're sending out on your behalf to make certain that we all stay in compliance, but you got a ton of really neat access to, well, reputable lead vendors in the area. And if you're in North Texas, particularly, you got 3 of these guys, 4 of these guys that are sitting right in our neck of the woods. So we have great relationships with these folks. It's a great way for you to establish a campaign where you're utilizing their services, you're not reinventing the wheel, and that sort of thing. We also have programs where you can access the responses from different mail campaigns. It's nice to direct your own output in directing what type of letter that goes out and that sort of thing to drive up your own response. You get the response daily. These obviously maybe a few days older than that, but they're untouched leads through 2 different partnerships that we have. We'll have an additional information for you, particularly on YEG's offering, because that cost is being driven down and they're adding a Medicare Advantage, compliant Medicare Advantage program as well. So watch for further information coming up on that. A great way to plug in additional people to speak to when one of your other marketing efforts aren't responding as well. Great way to add in some things really quickly. We do also offer that to the Facebook programs through an organization that gives us access through for Medicare's leads or final expense leads, 2 different programs, and we can get you additional information on that as well. That referral program, there's no better way of accessing qualified individuals that if you ask people you're visiting, who else do you know, can make a huge difference. You'll get a link to some suggestions on that as well. We go through all that simply because we want your business. We are asking you for referrals for other agents that we may be able to help as well, but it's you. So as you establish that relationship, if you haven't already with a marketer with Premier, we want to augment that with areas of interest where, hey, I want to be a player in the Medicare market in Texas, and I want my partner to be Molina. I want to do some additional things. We want to help push that relationship to where we need to be, because if you add it to your marketing plan, it's that lovely line out of the classic John Wayne movie, The Cowboys. Hey, we're burning daylight. We have an opportunity now. a lot of agents in just a couple of weeks or few weeks will start looking at what are 22 benefits. I don't know about you guys, I haven't achieved that independently wealthy status yet. I still need to be paid throughout the year. This is a great program that can help you be successful into AEP and through it. So all that said and done, I want to check and make certain that we covered the questions that are in the box. And yes, we have. There are different ways that we can speak with each other. Obviously, you can respond to the follow-up email that's going to come out. So watch for that to come out shortly as the recording updates. But we want to make certain that you have then a way to communicate with us proactively. So you can respond to that, or you can call the number 1-800-365-8208. If you're working with a premier marketer, they're going to walk through the possibilities that we have with Molina, and you can access a contact through Premier SMI as well. But we are going to reach out to you and we're going to say, hey, how can we help you? How can we make Molina a strong part of the offering that you have in the great sovereign state of Texas? All that said and done, we're almost at the top of the hour. Evidently, that third cup of coffee kicked in. I want to thank you for coming on and investing in your time, much as what Kevin did earlier today. We really appreciate your allocating some of your most precious resource, your time, with us. For those of you that have contracts with Premier, we thank you for that relationship. And of the folks that have those contracts and you submitted business, we surely appreciate that as well. Thank you for that. For the rest of you that may not be as familiar with us or look to work with us in the future, we want to thank you for that opportunity and look forward to those conversations. So until that time comes, last check, we're good with the questions. I want to thank you for coming on the line with us today. We appreciate our opportunity to work with you. And until we're able to actually chat again, I wish you good selling. Thanks so very much, and we'll talk to you very soon.